welcome to tonight's event. The BC Health Coalition is an inclusive and consensus-based network of organizations and individuals that advocates for a universal healthcare system that is publicly funded and delivered, publicly accountable, and publicly controlled. Sustainability has become the healthcare policy buzzword that has been used to justify all manner of cuts to public services. It's difficult to read a newspaper or turn on the television without being confronted by claims that more private for-profit healthcare is needed to ensure that our public healthcare system remains sustainable. They come at the same time that a group of for-profit clinic owners, led by Dr. Brian Day, they have targeted public health insurance regulations and protections in the courts. They want to be able to sell medically necessary health services to patients who can afford to pay a premium to jump the queue, and to open up BC to US-style health insurance. Minister Falcon has a responsibility to defend our public health care system in the courts and to protect patients from this attack on BC's Medicare laws. But he has appointed Kip Woodward, an investor in one of the key players in this legal attack on public health care, as the chair of Vancouver Coastal Health Authority, BC's second largest health authority. All of these developments challenge public health care advocates to respond to the arguments put forward by the for-profit proponents and to address the larger question: how do we sustain public health care?
When you allow the private insurance industry to gain control of your healthcare system, it's going to be very difficult to move forward any progressive reform agenda. And there is no one in this country that's a more determined advocate of healthcare privatization than Dr. Day. And he argues that because the system is doing such a poor job of delivering timely care, that people who can afford to should be entitled to jump the queue and acquire healthcare services before those in greater need. Dr. Day and other privateers like to wear the mantle of Florence Nightingale. What are they about? They're about rescuing people who are waiting too long on wait lists. And all they're trying to do is a public service to save the victims of our public healthcare system. Well, when you begin to understand actually how the clinic operates, the bloom comes off the rose. Dr. Day and his cohorts don't look like Florence Nightingale at all. They look like physicians who are exploiting the vulnerability of patients, some of the problems in the public healthcare system, for personal gain. We've always said it isn't compassion that motivates those doctors and the companies that own these private clinics, it's greed. And when you look at the facts that are emerging in the context of litigation, we're given an awful lot of support for that position. That will be very helpful as we move forward in confronting the pressure, and it continues and will continue to kind of bite off parts of the Canadian healthcare system because it's in the private interests of private companies and some physicians who will become very wealthy if we go down the path that the US has unfortunately chosen.
If you're a wealthy person, the United States is really where you want to be when you're very sick. But for the average person of average means, it's the last place in the world you want to be, in the developed world. What we have down there that we call a system is actually a $2.5 trillion factory. And inside this factory, there are clinics and hospitals and pharmacies and drug companies and medical supply people and insurance companies and lots of lawyers and lots of doctors. And they're all essentially economic entities. And what do economic entities do? Profit. That's what economic entities do. They try to create profits. The top 2 floors of the factory of this 10-story building are people fighting over money. They're insurance company employees who are arguing about what's going to be denied and what's not going to be denied and which insurance companies are going to not cover these people and not cover those people, so that 20% of all of the resources in this factory go directly to activities that don't contribute to anything to the quality of the product, which is supposed to be health. What single payer does is it gets rid of that 20% right off the top, and you get 20% more health right away, or health care right away. At the heart of this whole debate is that every country has virtually unlimited demand for limited resources. And so the question is, how does a society decide how they're going to allocate their precious limited resources in the face of unlimited demand?
As an economist and someone who really thinks that numbers are very important and can give us very important information to improve decision making, I get incredibly frustrated when I see numbers being used to mislead people. For example, we've been told repeatedly for 10 years or more now that we cannot afford to continue providing healthcare for people. But how much do people know? How much do we spend relative to other countries? BC is the third lowest spender per capita on healthcare. But if you look at why we can't afford healthcare, or why is it becoming such a big problem for government, it is that the trend of government spending as a whole, as a share of our economy, or our collective ability to pay, has been declining over the past decade. Government is spending less money on everything and less proportionately to what they can to the economy. And so as a result, the share of healthcare spending is increasing as part of the budget. This is because the budget is decreasing. The issue is there's a lot of very successful pockets of excellence within the public system. There's a lot of innovation that's happening. And this innovation is not being rolled out system-wide, if you like. The government spent quite a bit of money on pilot projects over the past couple of years. A lot of these pilot projects are entirely within the public system. They don't require any sort of introduction of a for-profit motive. And they're very successful, but they're not being expanded system-wide. If we want better services and more accessibility, then we have to spend more money. And the question is, do we want to spend it privately so that the people who can afford it can get it? Or do we want to spend it collectively so that everyone who needs it can get it? If we really cared about improving the health status of British Columbians, we would do things like tackle poverty, reduce homelessness, and address these so-called social determinants of health. And this would, in the long run, save us money within the healthcare system.
If we really want a system that works, what we need to do is to expand rather than contract, and rather than divide and conquer, which a two-tiered system will create, is we need to pull more services into our system and get economies of scale. Part of myself being proud as being a Canadian, and one of the things that I've touted for many years is our medical system. But if we look at history and we look at the Hall Commission, we haven't got far enough yet. Dental, prescription services. So we do need to look at this as a holistic process and increase rather than decrease our services that we have covered under our one-payer system. And it will be cost-effective.
On behalf of the BC Health Coalition, I would like to thank all of our panelists and thank everyone here for coming out and learning more about this important issue. We've heard some compelling evidence and strong arguments tonight. We've learned that the evidence is clear. A single-payer public health care system that covers everyone is the fairest and most cost-effective way to provide high-quality health care for all British Columbians, but it needs to be defended now. We've learned the evidence is equally clear that many innovative public solutions are available to address this issue of sustainability of public health care. What we see from the US and from examples here at home is that private health care costs more and provides less.